Thank you so much, Prof. Kim, for the warm introductions. Good afternoon, everyone. First of all, I would like to thank the Ministry of Food and Drug Safety of Republic of Korea for inviting me to this webinar. So today I will share Malaysia's experience in developing and implementing our National Action Plan on AMR. Of course, I will be focusing more on the human health because I'm a doctor. All right. Next slide, please. So Malaysia journey to address, okay. So Malaysia's journey to address AMR actually began in 1998 with the establishment of our national surveillance on antimicrobial resistance, which was led by the International Institute of Medical Research, or IMR. And then, so over the years, Malaysia actually strengthened its policy, including the launch of our policy and procedures on infection prevention and control in 1998, establishment of healthcare-associated multi-drug resistance organism, HAMDRO, surveillance program in 2003, as well as the launching of our national antibiotic guideline first edition in 2008, and also the establishment of our Animal Fat Act in 2009. And following the in 2015, following the 68th World Health Assembly endorsement of the Global Action Plan on AMR, Malaysia actually started our discussion in 2016, and we developed our National Action Plan at that time. And it's also led to the development of establishment of our National Antimicrobial Resistance Committee, NARC, with the 4 technical working groups. And in 2017, we actually launched our first Malaysian Action Plan on AMR 2017 to 2021. So the NARC actually play an important role in coordinating and also overseeing our National Action Plan, guided by the and the key stakeholders to drive this AMR include relevant ministries, medical, pharmaceutical, and animal associations, healthcare institutions, healthcare practitioners, non-profit organizations, researchers, academia, and NGO. And our NARC is actually co-chaired by the DG of Health and also the DG of Veterinary Services, and it is supported by the 4 technical working groups. And these technical working groups is responsible in providing input, strategizing actions, as well as monitoring the implementation of all the measures in the plan. And for human health, we also have the National Infection and Antibiotic Control Committee, which also support the implementation of the strategic action plan. And NARC actually report the progress and the implementation of this National Action Plan, including the challenges identified and action taken to address those challenges. So Malaysia actually developed our second National Action Plan 2022 to 2026 by conducting a situational analysis, including the National Health and Morbidity Survey, the KAP studies on antibiotic use, and MR, and we also used the track reports from 2018 to 2022, as well as the 2019 JEE findings for us to identify the critical gaps in order for us to develop the second National Action Plan. We also used the finding from 2019 WHO Integrated Global Survey on ESBL producing E. coli using the One Health approach, which is the Tricycle project, where Malaysia actually representing the Western Pacific region in this study. So basically, under our current MyApp AMR, we have identified a key priorities area to address the AMR more effectively, which include the public awareness and educations, surveillance and research, infection prevention and control, and last but not least, to optimize the antimicrobial use. We also have identified a few outcome indicators for our MyApp-AMR 2022 to 2026. The first one is to increase the level of awareness, knowledge, and understanding of AMR among the public. The second one is to reduce the antimicrobial use in animal sectors by 5% by 2026 compared to the level in 2022. 30% critically important antimicrobial for humans and veterinary medicines, not used as a growth promoter in food-producing animal by 2026. Fourth one, at least 60% of overall antibiotics consumptions in humans comprised from SS group of antibiotic by 2026. And last but not least, 30% reduction of healthcare-associated bloodstream infections due to selected MDRO by 2026 compared to the rate in 2021. So we have seen several success during the implementation of our MyApp-AMR, particularly in awareness, expanded surveillance and research, laboratory capacities, infection prevention and control, and AMS program, the vaccinations in humans and animal health, and also we managed to phase out the use of antibiotics as a growth promoters in agriculture sectors. So I will share with you some of the pictures regarding all these key successes. I'm so sorry because some of the picture did not come out in the slide. So raising awareness actually have been a critical component of our AMR strategy. Every year we have conducted the World AMR Awareness Week through a variety of activities, including webinars, forum, fun runs, and seminar. And in addition, we also conducted the AMR activities with other national events such as the Malaysia Agriculture, Horticulture, and Agrotourism Show, or during the Wellness Month. Recently, this year, we also successfully organized a roundtable discussions with the members of Parliament. This is collaboration with the British High Commissions. And we also have an engagement sessions with the Parliament Special Select Committee on Health at the Malaysian Parliament to brief on regarding our initiative in MOH, Ministry of Agriculture and Food Security, the National Water Research Institute of Malaysia related to AMR. So basically, this program aims to increase the awareness and support for AMR initiative among the parliamentarians. We also conducted numerous awareness campaign and educational program across the different regions, involving stakeholders from professional groups, farmer, veterinarians, food handlers, and public. For example, we have conducted the MyAMR conference recently to increase the awareness among the health professional, seminar on AMR awareness among the non-livestock, agriculture, and environment sectors policymaker. This is funded by the MyOHUN, to emphasize the AMR awareness among policymakers under the ministry or agency outside the livestock sector. And under the initiative of this tripartite program, working together to fight AMR in Asia, the Pacific Public-Private Partnership was conducted, which involved participants from various associations and industries in the animal health sectors. Another important component is the community empowerment programs has also been crucial. So for example, we disseminate the knowledge of AMR to the public during Know Your Medicines ambassador programs. And this program actually empower community leaders or representative in their locality to deliver information regarding AMR. We also produced promotional videos and posted it in our social media and also in our MyOHA websites. We engage with the social media influencers, where they also created the AMR promotional videos and share it to the public. And we also work with the universities to produce AMR educational toolkits. And we conducted, in order to ensure that our AMR message actually reach as many people as possible, we also conducted a various TV and radio campaign. And we developed and widely disseminated educational materials such as e-poster, infographics, brochures, pamphlet, and educational slides. And all these material were uploaded to our My OHA websites and can be downloaded to be used during training and awareness campaign. These are the example of educational or campaign materials. And some of the articles on AMR were also published in our social media, printed media, magazine, and newspapers. This one is another milestone for Malaysia. We actually launched our antimicrobial resistant diary during the third AMR symposium. So this diary actually is a compilation of personal stories from patients, family members, and healthcare workers impacted by AMR. So you can actually read the AMR diaries through the websites. Okay. We also conducted a few KAP studies on the appropriate antimicrobial use among the public health, veterinary personnel, livestock, and aquaculture industry. For example, between April 2022 and March 2023, one of the universities actually conducted a study on socio-demographic factors and public knowledge on antibiotic resistance. So basically, based on the study, we found out that the knowledge is still low among the Malaysians, and basically the educational program should engage more younger and lower socioeconomic population to increase their awareness on AMR. This one is another new initiative that we launched this year, the proper disposal of patient medicines for the Environment Sustainability Program, or MyMediSafe. This initiative is a collaborative effort under the National Environmental Health Action Plan in Malaysia. So with over 700 collection centers and the support of more than 30 strategic partners, which include pharmaceutical-related associations, privates and universities, hospitals, community pharmacy companies, pharmaceutical companies, medication disposal service providers, and health advertising company. This initiative aims at educating and encouraging the public to dispose their medicines properly. And this program is basically to ensure that the environmental sustainability and also to prevent the AMR. On the surveillance part, we also have continuously monitored our AMR trends in human, animal food products, and environments. For human health, we actually seen an increased participation in our national surveillance of antimicrobial resistance from the medical institutions, and we also continue monitor the community-acquired infection, particularly resistance E. coli in the urinary tract infections. We also have successfully implemented the point prevalence service on antibiotics and healthcare-associated infection, particularly the HA-MDROs and MDRO bacteremia surveillance. And also, this HA-MDRO and MDRO bacteremia surveillance is one of the key performance indicators for our Director General of Health, and it's actually helped us in providing us with valuable data for further actions. We actively share all the data, these AMR and AMU data, through the GLASS, TRACS, NMUs, and WePrax. So regarding the research, our research and collaboration effort have actually been fruitful, leading to increase in publication of AMR. As I mentioned earlier, in 2019, Malaysia participated in the tricycle projects. And in 2019, we continue with the Triumph project. Triumph project is the improving of the tricycle protocols, upscaling to national monitoring detection of CPE, and WGS pipeline for One Health surveillance. So this Triumph projects aims to monitor the prevalence of AMR, especially the ESBL, E. coli, and CPE, through a One Health approach involving human health, the food chains, and environment. And this project is still ongoing and expected to conclude it by the end of 2024. So As I mentioned earlier, all the report were uploaded and freely accessible in our MyOHA websites. Not only the report, you can also download the report manual, guidelines, SOP, research, educational materials from the websites. So with regards to infection prevention and control and biosecurity, we produce numerous educational materials related to IPC. So recently, our infection control unit, in collaboration with the WHO, UMMC, and the National Institute of Public Administrations and the Malaysian Infection Prevention and Control interest group, we produce an IPC online module. So this IPC online module aims to enhance the IPC knowledge among the healthcare workers, and it is designed for self-paced learning and utilize a variety of multimedia tools, and it is available under the EPSA platform. However, it is in Bahasa Malaysia, so and there are 7 modules which cover basic topic related to IPC, such as the hand hygiene, transmission-based precautions, standard precautions, PPE, and others. Okay. In service training of for infection prevention and control, we also regularly conducted the in-service training at the national, state, and facility level throughout the years in the form of conference, seminars, and workshops. So apart from the Ministry of Health, we also invited the non-MOH healthcare facilities, including the university, Ministry of Defense hospitals, the private hospital, to participate in this seminar. And IPC training is also integrated in the orientation program for healthcare workers. For example, the patient safety awareness course for house officer, where we actually included the IPC and AMR topic. And our Malaysian National Immunization Programs actually protect against 13 major childhood disease. And this vaccination service offered free to all Malaysians at the government health facilities and for school-based vaccinations. And the private healthcare facility also offer immunizations of the NIP vaccines and additional vaccine. Additionally, there have also been continued focus on ensuring the safety and effectiveness of animal vaccines, with significant achievement in controlling the disease such as brucellosis, rabies, and foot and mouth disease through vaccination program across the livestock and pets. Okay. With regards to the AMR, AMU, and AMS, we actually successfully review and publish a few guidelines. First one is National Essential Medicines List. Recently, we launched our national antimicrobial guideline during the MyAMR conference. We also have updated our protocol on AMS program in healthcare facilities. This one covers both hospital and primary healthcare. And we also produce national surveillance on AMU every year and presented it during the National Infection and Antibiotic Control Committee meeting and the NARC meetings. The other efforts to improve the AMS programs among the healthcare professionals include the AMS training for house officers during the orientation programs, mandatory AMS online module for medical practitioners for public, AMS workshop for the private sectors, and also we have a well-established AMS training and credentialing program for pharmacists. This is initiated by the MOH. And AMU activities and animal and agriculture has also made a significant progress. Surveillance effort actually expanded with more farms and premises involved in active and passive monitorings. Additionally, we strengthened the enforcement where we more than 500 as of August 2024, over 500 monitor manufacturers, sellers, and importers of animal feed were monitored. And Malaysia has also successfully phased out critically important antibiotics such as the colistin as growth promoter and for prophylaxis since 2022. Furthermore, we also have the incentive program which promoting the MyGap certifications, which actually increased, we have seen that there are increased a number of certified farms and premises. So despite all our success, we still have faced several challenges in implementing our MyApp AMR. The first one is with regards to budget and financial. Our National Action Plan is, the second National Action Plan is currently not costed. So yeah, we have limited budget and financing for some of the activities, particularly, in conducting the awareness programs, surveillance programs, and also in order to conduct the training programs. And in terms of the human resource, we have shortage of trained staff, particularly in conducting the surveillance, genome sequencing, data analysis, and for the WHONet data analysis. And with regards to governance and policy issues, we can see that some of the legislation are related to AMR fall outside our jurisdiction of certain departments, so it making that the enforcement activities quite challenging. And additionally, there's still lack of political commitment in some of the agencies. And also, despite the success in raising awareness, we still need stronger engagements with various stakeholders, including the media and the public. And technical and logistical issues, especially those related to advanced IT system for data analysis and reporting. Data integration and sharing across sectors have also been an issue for us due to different data management system and also varying level of infrastructures and capacity. So environmental surveillance presents its own sets of challenges. We identify there are potential gaps in our effort to monitor and control emerging AMR threats and coordinating multi-sectoral efforts. And last but not least, to reduce the antimicrobial use in agriculture is also a challenge to us because we struggle to balance the need for this drug to maintain the animal health and the importance to reduce the AMR risk. In conclusion, the MyApp AMR 2022-2026 has made significant progress, particularly in the raising awareness, surveillance, research, IPC, AMS, and capacity building. However, it is important for us to address the ongoing challenges with regards to sector coordination, stakeholder engagement, funding, human resource, data management, technical integration, and antimicrobial use in agriculture. Okay. So once again, thank you for the organizer for inviting Malaysia to this important event, and thank you so much for your attention.
Thank you.